This week, we dive into the criminal underworld of fake online pharmacies and COVID-19. The National Association of Boards of Pharmacy, the regulators that license pharmacists and pharmacies in every state, just completed an investigation into how fake pharmacy networks have pivoted to cash in on the pandemic. Have you ever Googled Canadian online pharmacy and gotten like 40 million results? Most people don't realize that these online pharmacies that they find in Google are not mom and pop businesses selling you inexpensive medicines because it's the nice thing to do. They're fronts for large global criminal networks that run hundreds or even thousands of sites to sell unapproved drugs for huge profits. Sometimes the drugs aren't FDA approved, sometimes they don't have enough or any active ingredient, and sometimes they have deadly ingredients. One study found that 30 fake pharmacy networks were behind more than 54,000 fake drug-selling websites. So all those results you find in Google for Canadian pharmacies catering to Americans, it's mostly just a handful of small criminal gangs. One Russian pharmacy network held a sales contest with a party so lavish, the top salesman received a solid bar of gold. Another Russia-based one called GlavMed and its sister company Spamit made $50 million in 2011 by hijacking people's computers with malware. The malware used your computer to send pharmacy spam email to drive traffic to their pharmacy websites. The FDA even warned GlavMed to stop selling unapproved drugs, one of which had been pulled from the US market. It had potentially life-threatening side effects, but was still being offered for sale to Americans. NABP's report on these criminal gangs identified tons of active websites illegally offering unproven prescription-only treatments for COVID-19, some which, if real, would be dangerous for you to take. Others made dubious claims about COVID-19 in order to panic people into buying their products. The wizards at the NABP showed many new COVID-19 sites are just fronts for established fake online pharmacies. And in fact, they even have the same contact phone number. Even others sell medical products that don't exist. Coronavirusmedicalkit.com claimed to sell WHO-approved COVID-19 vaccines for a $4.95 shipping charge. There's no vaccine for COVID-19. The Department of Justice took them to court, accusing them of wire fraud. NABP also found scammers are using domain name sellers who are safe havens for criminal activities. Over half of the active websites NABP found registered their domain names with one that's been called a notorious market by the US government. It's because they refuse to lock or suspend domain names running illegal online pharmacies, including hundreds marketing opioids to the public during the opioid crisis. And 90% of the COVID scam websites NABP found hid their domain name registration, which makes it hard for journalists, activists, and law enforcement to locate, research, and stop these scammers. But it doesn't have to be this way. Journalists, nonprofits, and law enforcement need bulk domain name owner lookup just like we need to see who owns titles to land in the real world. It needs to work just like it did for years before the corporation that governs domain names called ICANN and the domain name industry broke it. And right now, we're gathering support in Congress for that. You can send a letter to Congress on our website at www.safemedicines.org. It will take you less than 60 seconds to do it. Next week, I'll tell you how to identify the deadly counterfeit pill that's infiltrated 49 out of 50 US states and killed people in over 35 of them. One last thing. I want to plug a podcast I've really been enjoying called Heist. I've linked to their Twitter in this video description. The Heist guys love true crime as much as I do and research some spectacular crime in areas besides healthcare. Go ahead and give them a listen wherever you listen to podcasts.